So along the way, we've learned some lessons. And this comes under the category of lessons and beliefs held by me. So they may be totally wrong. When government decreases what it pays, be it Medicare or Medicaid, who picks up the tab? Because I already told you there's not a lot of profits for a typical hospital. So, and you know what the cost is. If one group pays less or doesn't keep up with labor costs or whatever, somebody else has to. Guess what? It's you guys, right? The big companies have, they basically are self-insured. Small businesses, they take it in the teeth. They're you guys who are the ones who pick up the tab for decreasing cost or decreasing payments on the Medicare, Medicaid side. Two, I said earlier, pure hospital, pure physician models don't work well. They need to be integrated. They need to encompass both. It's a topic which I'm not going to get popular reviews on, but rate regulation doesn't work. Okay? Now, I would benefit, and Stewart would benefit from rate regulation. Okay? Our rates are below the median. Our total medical expense is towards the bottom, especially when you factor in the fact that we pay taxes, a lot of taxes, and we have this huge infrastructure that's integrated that if you look at the others in this low TME, nobody else has. So we're well positioned. So we would benefit. Why do I say rate regulation doesn't necessarily work or doesn't work? Well, let's do the math. Okay, let's do the math. Let's say that you were going to take the top 30% of hospitals in Massachusetts, top third, and cut their rates 10%. Now remember, a major concession from those hospitals is we will lower the rate of increase. No one's ever talking about actually cutting their rates. I mean, they're talking about lowering the rate of increase. It's kind of a nice concept. It means you have a rate of increase. But, if you're talking about cutting, let's say you cut it 10%. So 10% times 30% is 3%. Okay. But hospitals are 40% of the health care expenditures. Well, 3% of 40%, that's 1.2%. So we just declared war on some of our largest employers in Massachusetts and some of our biggest facilities to save 1.2%? Does that make sense? And by the way, that's a one-time saving because you have no idea what the impact on utilization is going to be unless you put it into a payment system that mandates utilization or that controls utilization. So you could actually save 1.2% and increase healthcare costs by 10% because they're going to increase their utilization. So that's why I think rate regulation doesn't work. But also, I don't like rate regulation as, again, someone who would benefit from it because it takes the focus off the real problem. The real problem moving forward is utilization. The real problem moving forward is the expansion of services. It's about global payments. It's about getting everybody incentivized correctly, not about cutting one particular person's rates. And again, everybody else you hear that from, it's kind of at the higher end. I'm at the lower end. Global payments work. They really do. They set incentive and they work. They've worked for us. They force you. I think a good friend of mine at Partners, we have a good relationship with, said when they were describing a recent move they had to move towards that end, is he said to everybody there, he said, guys, you got to realize that taking that step is a big difference. So far, we've all been talking about getting on a diet, and we've all been reading on the internet about what diet we're going to take. You're basically going to lock yourself in a room with a ham sandwich and figure out how to survive on a ham sandwich. There's a big difference. So I like that analogy. Now, one thing that's out there just that I don't believe in, risk pools. So there's this concept that if a small group of people want to be at risk, and risk is an issue. I mean, you have to have reserves and you have to know what you're doing. You could lose your shirt if you don't know what you're doing and if you don't have money. That we should provide these pools that they can actually tap into to perform risk. Well, so let me ask you guys. If you're sitting at home and one of your neighbors comes and says, I've never played poker, but I want to go to Foxwood and play poker for the weekend. I don't really have money. I can't afford to lose money. Would you lend me $1,000 so, or not even lend me, will you give me $1,000 so I can go play poker for the first time? You're going to say, what are you, nuts? So, the global payment system works because you have skin in the game. If you have taxpayer risk pools that completely obliterate the downside risk and you give that ability to write those checks to people who are too small or don't know anything about risk and how to manage it, you're going to set yourself and us and the taxpayers up for one hell of an issue. I firmly believe now and believe then that solutions come from private sector. And many of the issues we have now, that we have regulations in place that were very well-meaning and worked very well in a fee-for-service environment. And now we're changing the entire model of providing health care, but the regulations were really created for a different set and a different environment, and we have to look at those regulations. Insurance regulations are one group, right? So akin to what I'm going to talk about next, right now, if you have a typical HMO plan, and let's say the premium is $500, okay, and people make the choice because they want to use community settings for most of their care. Some do. That cost is, we'll make up a number, $400. Well, but they don't get the benefit of that choice. They don't get the lower premium. It goes to subsidize people that go into town for everything. Well, most of your workers, most of your employees fit into that first category. Because the one thing that is obvious is the people that choose to stay locally and the people that go into town for everything, there's a very substantial socioeconomic disparity between those groups. So in many ways, you have a reverse subsidization going on, which doesn't make sense. Now, no one's intended to do that. That's not purposeful. It's just because of the regulatory structure, the way it works, and on a fee-for-service, and how a global payment system doesn't interact well with that current structure.